Hi everyone, I'm Katie Douglas with Acorn. Today I'm excited to show you everything Acorn Veterinary Scribe can do and how it helps veterinarians and veterinary staff spend less time documenting and more time caring for patients. Acorn is an AI-powered veterinary documentation assistant that's designed specifically for veterinary medicine. Instead of manually typing records after every appointment, Acorn listens to your consultation, converts speech into structured medical documentation, and helps organize your patient records automatically. It supports veterinarians, technicians, and other veterinary professionals by reducing documentation time while keeping records accurate and consistent. Let's get started. When you first log in, you'll see a clean, simple dashboard that's built around the veterinary workflow. Everything you need to operate Acorn is right here in the dashboard. Everything is organized so you can quickly create new notes, access previous patient records, review documentation, and continue where you left off. Unlike other AI note-taking software, every section has been designed specifically for veterinary medicine. I'll show you how quick it is to add a new patient and start notes within a minute. On our dashboard right here, you're just going to hit Create Patient, and we're going to enter the patient's information. We'll go ahead and enter a Bella because every clinic has a Bella. We'll go ahead and put the patient ID as well. What kind of species Bella is. Right here on the birth date, you can either put the exact birth date if we know, or we can enter an estimated age. We can also go ahead and put the sex of Bella and if Bella is fixed or not. We can continue on here by putting the breed, color, microchip information, and also the owner's contact information. That's not required, but of course, the more information that we have, the better we are with locking the information in with the owner. Once all of this has been entered, we're just going to hit Submit. Next step is we're going to go ahead and create our template for Bella. There's several different options. Today, we're going to go with the general soap note. Once that's been selected, we're also going to select the subjective, objective, assessment, and plan. The very bottom here, it's already going to create Bella's name along with her client patient number. At this point, you can also add in what Bella's coming in for. So we're going to go ahead and put in for diarrhea today. And then that's it. That's simple. We're ready to go ahead and begin documenting her visit. To begin documenting a visit, simply click Start Recording. You can record the entire consultation naturally. You don't need to change the way you speak. Have a normal conversation with the client while performing your exam. Acorn captures the discussion and converts it into text automatically. This means no more trying to remember everything after the appointment's over with. So we're going to go ahead and I'm going to pretend that we're seeing Bella today for diarrhea. So we're just going to hit the microphone to start the recording. Hi, Bella. So she's had diarrhea for about 2 days and seems nauseated today. Not really interested in food this morning with no new treats or diet change. I think we should start with a fecal exam to check for intestinal parasites and also some comprehensive blood work while we wait. We will give her an injection of Serenia to help with the nausea until we have some more information. And when you're done with the recording, you just hit pause. From here, we're going to hit Generate Notes. Once the recording is finished, you'll be presented with a full transcript of what was said in the room for you to look over, and then Acorn's AI analyzes the conversation and creates structured veterinary documentation. Instead of pages of transcripts added to the medical record, it produces organized clinic notes that are easy to read. Acorn identifies patient history, clinical findings, assessment, treatment recommendations, follow-up instructions. Everything is organized automatically. So right here, we've been presented with the transcript of everything that was said in the room. If at any point you need to change or edit any of this information, you can click If Bella's name is spelled in a certain specific way, we can change it here. Or if you need to take anything out that doesn't need to be in there. From here, you're just going to hit confirm. One of Acorn's biggest strengths is generating SOAP notes. The AI separates information into 4 sections. Subjective, everything the owner has reported to you. Objective, physical findings, vitals, diagnostics. The assessment, clinical interpretation and diagnosis. And plan, the medication, treatment, follow-up recommendations. Rather than typing every section manually, the note is ready within seconds. So this right here, we again still have all of our transcript of everything that was said in the room. And then further down, we have where Acorn has now put it in the SOAP note form. We have Bella's information. Again, if some of this is not filled out or is not mentioned while in the room, it'll just be listed as not mentioned. The nice thing is we can easily go and edit and type in anything that we need to. So you're still in complete control of the medical record. It lets us know the duration of the problem that was picked up in the room for 2 days, how long the nausea has been going on, that there's been no recent diet changes or new treats. The assessment's going to give us a breakdown of exactly why Bella came in for today and what our next steps are going to be. This is also going to let us know that we're planning on doing the fecal exam and also what it's for intestinal parasites. Same thing with our comprehensive blood work. And that's also planned just to help for the general health. This is a nice thing for any of our patients' owners to be able to see exactly why we're running the test that we do recommend. The other nice thing that I love about Acorn is with medications. A lot of our medications sound alike. I don't know why we decided to do it, but here, Cerenia picked it up amazingly. But if we just click on this, it will give us all of the medications that sound like Cerenia that could have been misspelled. If we needed to change it, all we have to do is select and it'll switch it over. We don't have to worry about that now because again, we have the correct medication that was selected. If there's any x-rays or any additional documentation, we can upload it into this area and then we're going to submit notes. And that's it. Your record has been submitted. We're going to go ahead and visit over here to one of our other patients that we have with Layla, who I put in here for having pancreatitis. One of the positive things about Acorn is, again, this lets us know why Layla was here, the breakdown of what she got while she was here with us, her problem while she was here, and any medications that were sent home with her. At the very bottom, it does have all of our client education as well. Patient is being discharged for acute pancreatitis, continue on oral medication as prescribed, and if there's any follow-up needed at that time. At the very top is one of my other favorite features about Acorn, is our discharge summary. Most of the time when the dogs or cats owners come to pick up the patient, they're just excited to have their animal back. They're not really listening to half of the stuff that we're saying at discharge. The nice thing about this is it has everything broken down for you. So this lets you know exactly why Layla was here, the physical findings while she was here, her diagnosis, the procedures that were done while she was here, her medication that she's being sent home on, and what that medication also does, and also any kind of home care instructions. So for the next 7 to 10 days, feed Layla low-fat diet like Purina ID and small frequent meals. Lets them know what to monitor for at home and also any kind of follow-up instructions. This is great for any kind of owners who, again, are just excited to get their animal home, once they get home and get settled in, they're like, oh no, what was I supposed to do? This is a quick summary of everything that was done. And all you have to do is hit send email and put our client's email address right there, and it goes directly to them for them to pull up anytime. Acorn also offers several different templates. Every doctor does medical notes differently. Right here, you could type in however you prefer your medical notes. If you wanted one just for wellness exams, we could type this in here, a description of what it's for. And you can either start from scratch, or if you have a previous PDF file that you've been using that you like, you can upload it here, and our AI will take everything else from there. Acorn allows practices to create customized medical templates for routine wellness exams, puppy visits, dental procedures, surgical rechecks, emergency appointments. Using templates will help standardize records across the entire clinic. Your CSRs, your technicians, your assistants will know exactly where all the information is that they need, because everything will be in the same place every time they look at the medical record. We're going to go ahead and go back to our dashboard. And I'm going to show you, we'll start with Bella again. Except for this time, I want to show you a really cool feature, and that's going to be our dental charting capabilities. So we're just going to click Canine Dental Chart. Again, it's going to give Bella's name along with her client and patient ID, and we can type in what she's coming in for. At the very bottom here, we actually have a preview chart. This is going to give our legend of what all of our color coding is for any of our dental issues. This is a great feature for any of our new assistants or technicians that are learning how to do dental charting. Right below that is also going to give us our dental chart with the teeth and the number directed for each one of the teeth. All right, and so again, all we have to do is select the microphone to start recording, and we'll go ahead and get that started. Again, I'm just going to go ahead and go with Bella, and we'll see how everything works together. Bella has been eating normally, but her owner has noticed bad breath over the past few months. On examination, she's bright, alert, and responsive. Heart and lungs are normal. Oral examination reveals moderate calculus on the max premolars, gingivitis, and mild periodontal disease. Tooth 108 is fractured, and teeth 309 and 310 are missing. I recommend a professional dental cleaning with full mouth dental x-rays while under anesthesia. And once I stop recording, I'm just going to hit pause and generate notes. And again, this is going to go ahead and give us a full transcribe of everything that was just mentioned. So if anything needs to be changed or edited, we can do that right here on this screen. Everything looks good, so we're just going to hit confirm. Dental procedures often require detailed documentation, and creating dental charts manually can take a significant amount of time. With Acorn, you can document your oral examination naturally as you work, as you describe findings such as missing teeth, fractured teeth, gingivitis, periodontal disease, mobility, calculus, extractions, or other abnormalities. Acorn helps organize those findings into your patient's documentation. Instead of stopping to manually enter every observation, you can stay focused on the patient while documenting your exam through natural conversation. This can make dental appointments or dental surgical procedures more efficient while helping maintain clear, organized dental records. All right, so our voice note has been transcribed successfully. So we're just going to come on down here. This is still going to give us our legend so that you can refer back until you get more comfortable on exactly what colors match up to the exposure or the gingivitis or mobility issues. Down here on our chart, we have this nice color coordinated charting system, which is going to let you know everything that's going on. So we have our fracture, our periodontal disease, our gingivitis, and then also our missing teeth down here. Right below that, we're going to have our basic general soap note. So this right here is still going to give us our history of exactly why Bella came in, what we found on her physical exam, what her oral findings were, her assessment, and then also what the treatment plan is, which is the full mouth dental x-rays while under anesthesia with a professional cleaning. And then if she was coming in and we had already done the dental x-rays, we could add those right here in her file as well. So everything is consistent and all together in one area. And again, if Bella's owners needed this information as well, we just hit discharge summary. And this is going to have all of the information that was discussed with Bella's owner for today. Acorn isn't just another AI transcription tool. No more typing detail after every appointment. No more staying late to finish documentation. Just accurate, efficient clinical notes created from your natural conversation. Acorn takes all of the work out of documentation so you can focus on delivering exceptional patient care, not paperwork. It's that simple. Talk, tap, done. Thanks for joining me today. If you'd like to book a full demo, please contact me at Katie@Acorn.vet. Thanks. Bye.